Let's talk about photodynamic therapy. If you look on the internet, you'll find all sorts of stories, and they're true in relation to the sensitizers that they're talking about, but they're not true to the photodynamic therapy that we do here. Here's some of the problems. First off, let's talk about the basics of photodynamic therapy. It requires the use of a chemical which reacts to a certain wavelength of light, and each chemical requires its own wavelength of light. And it also requires that oxygen be present in the cell. That's why alkalinity is so important. So, where did the problems come in? First off, the light has to be able to get through the skin and through the body in order to actually treat cancer that's inside the body. There's very few wavelengths of light that will actually do that. The most common photosensitizer in the United States is called Photofrin, and its problem is that it's activated more by UV than it is by the red light that it's supposed to be activated by. Consequently, after you've had Photofrin, you've got 2 months that you cannot be, you not only cannot be outside, you cannot be exposed to any light other than a fluorescent light bulb. Even an incandescent light bulb will burn your skin. That means that treating it from the outside is totally out of question, because it accumulates in the skin more than it does in the cancer. The next most common one that's used in the United States is aminolevulinic acid. Now, that's not really a photosensitizer. It's a chemical that interferes with the production of hemoglobin, and in that process it builds up another chemical that is a photosensitizer. That, unfortunately, is also activated by the same wavelength as Photofrin. The problem is, Photofrin and ALA are activated at 635 nanometers. Now, when you were a kid, did you ever stick a flashlight in your mouth and puff your cheeks out? You notice you're putting in white light, but all you see coming out is a deep red. Everything else is absorbed by the body. You cannot get blue light or green light or yellow light into the body. As a matter of fact, there's different shades of red. And 635 nanometers is the peak at which hematoporphyrin, the main component in your red blood cells, absorbs light. So they're pretty much worthless for treating anything except for skin cancer or something that they can put a laser right next to. They use it in esophageal cancer because they can put an endoscope down your throat and put a laser light next to it. They can do it with some types of lung cancer if the lung cancer is at a point where they can get a light next to it. But it does massive damage to normal tissue because it goes 3 times as much to cancer as normal tissue, which means that your normal tissue is going to get 33% as much damage as the cancer. I've seen patients that have been burned horribly with the use of other sensitizers. There are probably about 40 different sensitizers, of which 35 of them are completely worthless. The next most common one is chlorin E6, and that's made from anything that's green. Okay, the problem is chlorin E6, that's activated by 666 nanometers. And that's better, but even with that, you can only get about 5 millimeters into the body. So treating deep down inside the body is impossible with most sensitizers. The sensitizer we use is one that I created personally, and it's a spatial blend of two types of aluminum phthalocyanide. The characteristic that determines whether something is good for treating cancer or not, in addition to the frequency of light it responds to, is whether it will pass through a cell wall. Chlorin E6 is completely water soluble, so it will not pass through the cell wall, and it washes out of the body in 24 hours. And like all of the rest of them, it goes to normal tissue almost as much as it does to cancer. So what have we done? We've created something new, a fourth generation sensitizer. The first generation are the things that activate at 635, and then the second generation are chlorin E6, and then there's the methylated porphyrins, which there's Perletin, Levulan, number of other sensitizers that have a metal in them. And we use aluminum in our sensitizer. Now some people say, oh, gee, aluminum's bad for your body. Yeah, it is. But the amount of aluminum that we give in a full dose of sensitizer is about 1 to 2% of the amount that you get in your normal daily diet. So we're not really adding a lot of aluminum into the body. How do you get it to where it just goes to the cancer? Well, that's where the real secret comes in. You need to have a nanomolecule. And the way a nanomolecule works is it's too big to go through the blood vessels. When you eat food, it's digested. How does it get into your body? It goes between the walls of the cells through the capillaries that are lining through all the way through the stomach and all the way down through the colon. But if you swallow a marble, obviously that's not going to be able to get through the space between those cells. What size can get through? So if you make a molecule that's between 20 and 60 nanometers in size, it cannot get out of the blood into normal tissue. But when it finds cancer or an infection or an inflammation, those make what's known as leaky vasculature. The vessels have more space between the cells. So cancer has what's called leaky vasculature, limited lymphatic perfusion trap. Therefore, when you make a molecule that's, ours are between 20 and 40 nanometers in size, and that size is perfect. That goes out when it finds cancer and it floods the area where the cancer is, but it doesn't go into normal tissue. Consequently, we can treat a person from the outside with a laser all the way down to the center of the body. And we've proven this by treating brain cancer all the way through the brain just by putting the light on the outside of the head. That's really a remarkable achievement. Nobody else in the world can do this because they don't have the nanomolecule that localizes the sensitizer into where it needs to be. When you use a normal sensitizer, that sensitizer that leaks into the normal tissue has two side effects. One is it causes damage to the normal tissue when you hit it with a laser. The other is that it absorbs the laser light just like the blood does, so the laser doesn't get in deep enough. Now, our sensitizer is activated at 690 nanometers, which is the lowest point of absorption in the human body. You'll hear people talking about infrared sensitizers. They don't work because when you go into the infrared, water is absorbing the energy and it basically cooks the tissue. Our sensitizer is the perfect wavelength, and 98% of it goes only to cancer. No other tissue in the body, even the liver where it normally accumulates, only develops like a 2% level of photosensitizer. So the resonance, the light that's used, is critical. Now, you'll find people talking about sonophotodynamic therapy. These same people have tried to buy my technology for years. I won't sell it to them because they use ozone. And as far as I'm concerned, anyone that uses ozone is a fraud, because ozone kills normal tissue faster than it kills cancer, simply because cancer is designed to protect itself against oxidation. It has more glutathione, like 3.5 times more glutathione than a normal body does. 16 people in the Philippines were treated with ozone therapy by 6 doctors from the United States. Within a week, they were all dead because it basically dissolved their gut. It dissolved their colon and their large intestine, and their small intestine just turned to jelly and dissolved. It didn't kill their cancer, but it killed them. 5 of those doctors went to prison. The other one escaped to someplace in China. So when somebody starts talking about ozone therapy, run. And if they start talking about sonodynamic phototherapy, run, because they don't have the right wavelength to have any effect. They will tell you that the ultrasound activates the sensitizer. That's just incredibly stupid. Only a total idiot would say that. That's like saying that you can shoot a tank with a BB gun and kill everyone inside the tank. It requires large amounts of energy which simply do not come through with the frequency of ultrasound that they use. And you cannot activate a sensitizer with ultrasound. Any doctor that tells you that is a complete idiot. The other thing you need to do is look at what they use for a light source. If they're not using lasers and they're not using 100 watt and 200 watt units, they don't know what they're doing. There's several places around the world that will tell you lay under these fluorescent lights, and some of them put fluorescent lights in a suntan bed, and they put Grolux bulbs in them because they hope that that will help. I've analyzed the frequency that comes out of those, and I've analyzed the frequency that's required by their sensitizer, and I'm telling you, it will not work. Not under any circumstances. There's people in Mexico, there's people in China, there's people in England, there's people in Ireland, there's people in Russia that are trying to use chlorin E6 and a bank of fluorescent bulbs. Their patients are all dying. One of them has 100 testimonials on their site. Someone that I work with, her daughter died there. And 4 years later, she finds that her photo is still up as a testimonial of one of their successful patients. Well, she knew some of the other patients that had been there, and she went looking for them, and their photos were all still up as successful patients. So she had her son start checking the obituaries in the towns they came from. Out of the 100 testimonials on that site, all 100 of those patients were dead. But they're still telling people that they cured them. That's hope for Mexico, hope for cancer in Mexico. You can cut that out if you want to, I don't care. You cannot believe anything that you see on a website unless they show before and after scans. My website is the only one that actually does that.